Right. Hi, everybody. Thank you for being here. Welcome to the Living Dharma podcast. And today I'm very excited to have a very, very special guest, Dr. Stephanie Higashi. So Dr. Stephanie, would you want to first give us a little intro as to what you do and what Health at Last is?
Absolutely. I'm the CEO and founder of Health at Last. It's the first and only multi-specialty healthcare franchise in the world, and we offer medical, chiropractic, acupuncture, massage, and physical therapy at all of our clinic locations across the country. And our whole goals and purposes are to help lower and eliminate unnecessary drugs and surgery and provide function, health, and joy so people can literally enjoy the freedom of health.
Love that. That's fantastic. Totally aligns with my values and what I preach and what I practice. I'm all about healthy living from the inside out and the mind, body, and skin connection. And I was in a meeting one day and you started speaking about the health of your gut and how that relates to mental health and prescription medication. And I found it fascinating. So I'm wondering if you can give us a little intro to that subject and like how that all works and really like your gut can affect your mental health. You can tell us about that. That'd be great.
Yeah, I'd love to share that story. I can tell you my background in researching all of this, interestingly, started when I was about 6 years old. My mom was a single mom and she worked very, very hard and unfortunately didn't know a lot about health. And so she would mostly eat Snicker bars, and Pepsi was her go-to drink throughout the day. Obviously not the best thing for bone health or gut health or anything else, because if people don't know, soda does break down your immune system. It can, eat up stuff. If you throw Pepsi on a car, you can see how it eats the car paint. It's not definitely the best thing for the insides, but well marketed in the United States. And unfortunately, while working kind of her job, taking care of me and somebody else, she ended up having a massive headache where she was wrongly diagnosed and treated at a hospital and put on psychiatric drugs and later institutionalized and experienced electric shock therapy and a lot of different things. Yeah. So since I was 6, I've been experiencing, family members that had issues, and I wanted to try to solve them and wanted to see what's the root cause of this and things like that. And I can tell you at the beginning of time, that was back in the 80s. And sometimes even today, until most recently, doctors would tell patients like, well, if you were on antidepressants or if you've been put on an antidepressant, you need to take it for the rest of your life. It's kind of like if you're a diabetic, you're going to need it forever. This is something you're going to need for the rest of your entire life because you have a chemical imbalance. And most recently it came out and they said, the Psychiatric Molecular Journal said, actually this chemical imbalance isn't true. And we're sorry that we've actually been telling all of our patients this fact, which is pretty amazing and pretty intense for a lot of people that have been told, or their families been told, like, you got to take this forever, right?
Wow.
So when you look at the actual history of antidepressants, you look at like, how did these actually get created? And most fascinatingly, most common antidepressant or anti-anxiety kind of medications, they're called SSRI, which stands for selective serotonin reuptake inhibitors. And so if you can think with that, in the brain, there's like these two little spots, and like the little neurotransmitter goes from one spot to the other spot, it engages with it, and then it creates a chemical reaction. So what these medications are supposed to supposedly do is prevent this engagement from getting undone and staying a little bit longer. So it kind of tries to inhibit this reuptake of serotonin. Fascinatingly, if you ask yourself or even other doctors or the public and you say, well, this chemical, this thing that they've been talking about that's been an imbalance, where does this come from? Where does the majority of this come from? The serotonin thing. And I've even surveyed just full-on medical doctors of chiropractic, which is what I am, and things like that. And they'll say the brain comes from the brain. And actually, they found about 95 or more percent actually comes from the gut, which people had no idea. They were just like, oh, I didn't know this where it comes from.
Wow.
So you go, okay, good. So what's happening with these SSRIs and what's happening with this depression? And I don't know, this is a very common sense question, is how come when people take these antidepressants, one of the warning signs is increased depression, worsening of depression, increased suicidal tendency. Like, it doesn't even really make sense. Like, okay, I'm going to take an antidepressant, but it can make me more depressed. Like, how does this work? So if you look at the history of the SSRI, the selective serotonin reuptake inhibitors, they were actually first founded when they were trying to test to find a cure for tuberculosis. So what they were doing is they were trying to cure tuberculosis and trying to figure out tuberculosis, which is kind of this lung disease, bacterial type of thing. And so what happened is they found that somehow when people were taking these medications, they were gleeful or happy. And so they were like, well, maybe this will help with depression. Well,
Wow.
if anybody in modern time, or any female particularly, that's ever taken an antibiotic, they know that it causes a disruption of bacteria and yeast. Though maybe a woman might have like a yeast infection or something like that. They know that this happens. And it's usually why doctors say, oh, if you take an antibiotic, you need to then take a probiotic as an example, right? Because we have all this bacteria in the gut. And if you wipe it out, it messes it up. So if you get the history of these SRSRIs coming from, the development of an antimicrobial or antibacterial type of drug from tuberculosis, that's what it was being tested for. So you know that that's kind of like the essential basis of it. Then you can then think with how does it actually affect the gut and the gut normal bacteria flora that's there. So what happens is when it takes out this gut flora and it messes up this gut, inside the gut are called neuroendocrine cells. Neuro meaning the nervous system, endocrine meaning, the endocrine system. And those are the cells that are releasing the serotonin. So the theories basically now that we're seeing is that the SSRIs are actually destroying the neuroendocrine cells of the gut. And when those are actually getting destroyed and damaged, and that's the majority of where serotonin is made, it then makes sense you're going to feel even more depressed.
Wow.
So this really explains why is this side effect? Why have people been having worsening of depression? Why are they having weight gain? Why are they having sexual dysfunction? Like, why are they feeling maybe less excited about life? Like, what's happening? And so, of course, anyone who's been on these medications definitely can't just like stop. Like, that's definitely not a thing because it's your body gets used to it. It has dependencies on it. And I would tell you, just because my undergraduate degree is in biochemistry, biochemically, these things can stay in your body for sometimes months, at a time. So sometimes somebody might say like, oh, well, I stopped taking it and I'm just going to stop taking it. And I feel fine, maybe even after a week, but maybe as they get to month 2 or 3, all of a sudden they don't feel good. And usually what that is the body might have a withdrawal and is trying to balance out what it's been given chemically. So you go, okay, great. We know sometimes people get depressed. What do we do? How do we handle this? And then how do we solve if someone's been on these SSRIs? I think is really the key question that I would ask if I was a patient, right?
Right.
Well, first thing would be we need to change the diet. So luckily my mom, after many years, probably from age 20 to 40, she was on antidepressants, was actually able to fully get off of all of them for the rest of her life. And so it is totally possible, right?
Wow.
But a lot of it comes down to changing the diet, not eating Pepsi and Snicker bars for every meal, right? Not skipping meals, not just like, smoking and just drinking coffee and caffeine. It really comes back to really eating healthy, which I know everybody knows that, but it's like, what does that mean? Usually recommend people to have half their body weight in ounces of water. Most people don't have enough water, so waste just sits in their system too long. It means to be able to have a pre and probiotic so that there's the natural gut. And particularly if you gone through a history of taking antibiotics, had ear infections, people take it for acne, whatever they've had for antibiotics, they need to replace those bacteria that have been wiped out and balanced out, right? And there are technologies we've been using, Viome recently, that actually test to see what which bacteria you might be lacking or which ones you might not have or need, and then they can replenish it and custom to your body. So pre and probiotics is super essential. The second thing is that when someone's been taking a medication or has been experiencing a tremendous amount of stress, loss of relationship, loss of a cat, a dog, a loved one, a marriage, a house, whatever it may be, that does create stress and deplete some of the chemicals of the body. So one of the technologies we've been utilizing are amino acids, and these amino acid formularies, and amino acids are the precursors to protein, and these have zero side effects because it's just like the building blocks that the body needs. So one of the things is you utilize these amino acids, pre and probiotics, the body heal, you start eating healthy, eating naturally, working with physicians, you can start lowering and eliminating these medications if you're already on the medication. And I think just changing the lifestyle and connections in life. But you're right, Dharma. I mean, water, food, gut health, life, balanced life is really essentially the most important part of it all.
Wow, I learned so much in that short amount of time. That is fascinating.
Yeah, I mean, the one thing I would tell people is the skin is the largest organ of the body and it represents what's going on inside. So if people have chronic acne, inflammation, scaly skin, dry skin, itchy skin, it means that's going on inside, also in arteries and in your lungs, in your heart, and your other tissues. And so it's usually a reflection of either reactions to food, diet, nutrition, chemicals, stress, and something needs to be addressed. It then helps not only the outside but the inside.
Yep, I love that. Amazing. Thank you so much for your knowledge that you have shared with us today, for your time. I know you're very busy. So where should people go check you out or go follow you, or how can you help anyone that might be interested in working with you?
Yeah, great point. So it's called healthatlastclinics.com. So it's health and then ATLAST clinics with an S.com. They can go to healthatlastclinics.com, find about any. We're always adding locations. So there's some that are in the wings getting ready to be added. But whether you want to work with us at Health at Last and be part of Health at Last as a provider, or if you want to be a patient, or you have a friend or family that needs help, that's what we're here for.
Yep, I love it, because you are a franchise, right?
That is correct. So we're always reaching out, growing, and helping more people.
I love it. Fascinating. Thank you so much, Stephanie. We
Thank
will be in
you.
touch. Thank you, everybody, for
Okay.
watching. I'll see you on the next
Bye.